I think I always knew I wanted to be a doctor. I'm the first doctor in my family, and I went through school knowing that I wanted to help people in some way. And for me, in medical school, surgery was the greatest way to do that. My interest in head and neck oncology dates back to when I was in probably medical school. Since then, it's kind of been fostered, and after my surgical residency, I did a specialized fellowship where I went to Johns Hopkins Hospital and trained in advanced head and neck cancer surgery. I specialize in robotic surgery as well as other minimally invasive techniques to treating head and neck cancers. That encompasses cancers that are in the thyroid, parathyroid, salivary glands, neck masses, skin, including melanoma and advanced skin cancers, the throat, tongue, oral cancers, and voice box. So head and neck cancers, whether they're benign or malignant, can have a very high impact on our daily life, even without us realizing it. There are certain functions that we tend to take for granted. We wake up, look in the mirror, we engage in conversation, we eat, drink, socialize, and interact with each other. And even a slight fluctuation in any one or more of those functions can set our whole life out of balance. And head and neck cancers can certainly do that. The other aspect of head and neck cancers is the extremely complex anatomy associated with it. And the combination of those two features really requires a very specialized effort to treat it. So in many cases, we're able to access these tumors in a minimally invasive fashion. Robotic surgery is one of them. For many cancers located in the back of the throat that would otherwise require a more extensive surgery, we can potentially avoid those by accessing the tumor through the mouth using very fine instruments and the aid of the robotic system. So it really helps with the patient's recovery, and it minimizes the impact of the actual surgery in treating the cancer adequately. The Milton J. Dance Center has an exclusive head and neck cancer multidisciplinary team. And that includes other head and neck surgeons for myself, radiation doctors, chemotherapy doctors, as well as a plethora of rehabilitation type clinicians, including speech-language pathologists, dietitians, nutritionists, social workers, as well as other specialties such as radiologists, pathologists. And we all work together to present each cancer case that comes in. We evaluate it and come up with a personalized and coordinated treatment plan for each patient. From the surgical expertise to the time between the surgery and the adjuvant care such as chemotherapy or radiation, including rehabilitation, this is really the most optimal way that head and neck cancer patients receive their care. I think that in terms of having everything all under one roof and having all of the experts meeting as a coherent and cohesive team, the Milton J. Dance Center is top-notch and probably the standard by which all head and neck cancer patients are treated. It's where I would want my family treated.